It's Friday, April 28th, and it must be time for another legislative update from your North Carolina Medical Society. It's been crossover week, so we're actually recording this on Thursday, coming to you live right after session has broken. The Senate wrapped up early this morning. The House just finished a few minutes ago, and we wanted to give you an update on exactly what happened this crossover week. Just to kind of tell you where we are, we've had 1,600 bills introduced between both chambers. So far, only 14 bills have finished both chambers and been sent on to the governor, 8 of which have been sent on to the governor. Only 3 of those have been vetoed, and all 3 of those vetoes have been overridden, but nothing has become law as of yet. So we're still very early in the legislative session, even though it started in January, and here we are all the way at the end of April. But now is when you're going to start seeing a lot more bills actually moving, because remember that crossover week is when all the bills in one chamber that did not have a fee, a tax, or an appropriation had to get over to the other chamber. So now the pressure's on to get it done, a House bill over in the Senate or a Senate bill in the House. So we're going to see a lot more bills actually finishing instead of just being discussed. On our priorities, I want to give you some quick updates because we've had some big changes this week. First of all, on scope of practice, the nursing bill was not eligible for crossover. It has a fee change in it. So that bill is good all the way through the end of the year. We're going to have to be diligent on it, continue those conversations with your local delegation back home. They're actually going to be at home an extended weekend because there are no vote sessions on Monday and possibly even on Tuesday. So this is another great time for you to reach out to your legislator back in district, catch them at the office or catch them for a cup of coffee and have a conversation about this really big priority issue for us. Talk to them about opposing the expanded practice for nurses, independent practice for nurses. The other big scope issue that we've been talking to you about a lot is optometrists wanting to do surgery. And this week, that bill was converted from a scope of practice bill to a study bill. The study is going to be done by the North Carolina Institute of Medicine rather than the North Carolina General Assembly. So we're looking forward to a robust conversation about the science behind what we've been talking about, the actual training that is occurring, and hopefully having a good report come from the North Carolina IOM, which is not due until October of 2018. Even so, this bill is still alive, and it's something that we're going to need to continue to talk to our senators about, because now there's a bill that's going to be over there. We don't want it converted back into a scope bill and turned into something that we really don't like. So make sure that you're continuing to have conversations with them about the importance of training when it comes to surgery, that people should not get a weekend course of training, but they should actually have years of experience in training in order to do surgery. On insurance, Senate Bill 629 is one that we've been talking to you about. It was not moved this week, but it still could be turned into some other kind of bill. It still could be dropped into another bill format. So we want to make sure that you're continuing to talk to your legislators. It's really important for you to be talking to your individual legislators. Last week, we had you emailing the entire Senate Healthcare Committee because we weren't sure where this bill was going to pop out. Now we're going to set back the action alert to be geo-targeted so that you're talking to all of your legislators. So if you have not contacted your personal senator about this bill, now's the time to do it. The important thing, though, is to make sure that we're talking about more than just the fact that this is going to set an arbitrary rate for out-of-network services into statute. Remember, we said it was going to set Medicare as the rate that you were going to get no matter what if the negotiations in your contract failed. There are lots of other problems with this bill. Legislators have heard loud and clear, senators have heard loud and clear from you that one piece is a problem. We need to make sure that they understand there are multiple other problems that need to be addressed in 629 as well. So we'll be setting up a new action alert for you. But again, if you're talking to them back home about nursing, talk to them about this insurance issue as well. In addition to those bills, the helmet law bill that we've opposed also attempted to move this week. Now remember, this bill was to allow folks to ride motorcycles in the state of North Carolina if they were 21 years or older without a helmet. We see this as a public safety issue, something that shouldn't be done. We recommended against this bill and opposed it. It passed through transportation, went quickly to the floor, but then ran into some hiccups and was removed from the floor. So that bill is still out there, but it didn't make the crossover deadline. In addition to that, just lots and lots of bills passed this week. Okay, we saw bills in the House going all the way until 10:30 at night one night. We were here till midnight last night. So there is lots and lots of updates on the legislative website. If you'll go there and check things out, you can see exactly what moved and whether it's made crossover or not. We're going to try to go back and tag all these different bills with some kind of tag so that you can see whether it made that crossover eligibility or whether it didn't matter that it made that crossover eligibility. Like I said, if it has a fee or a tax or some kind of appropriation in it. So look there for further information. But a couple of other pieces of information that happened outside of the legislature this week, or really just outside the legislative process this week. The first that you really need to be paying attention to. So get your calendars out and mark these down. North Carolina DHHS is having a listening tour in 4 sites, in Asheville, in Greensboro, in Raleigh, and in Greenville over the next 2 weeks to listen to your opinions about what we need to do with Medicaid reform as we're transforming into Medicaid managed care. Now is the time. We've got a brand new secretary. She's in place. We've got new staff over there. And they didn't hear all the debate from 2013 until now about the impact that was going to occur in your practices. So now is the time that you need to be showing up to these forums and talking directly to DHHS staff and the new secretary and letting them know what are the administrative hurdles that you're worried about? What are the problems that you're expecting with moving to managed care? And what do they need to do to make sure those problems are minimized as much as possible? Remember that we're not able to relitigate the whole thing about whether we're going to managed care or not, but now is the time that we can make this as smooth a transition as possible. We can make them aware of problems, and we can try to get ahead of those problems before they affect you and before they affect your patients. And the last thing I want to talk to you about today is Crossover for a Cause. This is something that our statewide North Carolina Lobbying Association did this week. We've had 3 lobbyists here in the General Assembly that have all had transplants, organ transplants. And we wanted to honor them this week by raising awareness about Donate Life. And of course, April is Donate Life Month. So we all contributed to a fund. We raised over $3,700. We wore our sneakers so that the legislators didn't outrun us during this crossover week with our suits and our skirts and everything else down here. So it was kind of a funny season of seeing brightly colored sneakers with dark suits running all around the building, but it was for a great cause to raise awareness about organ donation. We hope that you're making sure that you're telling your patients about organ donation too and how easy it is to share life. So on that, I hope you have a great week. This was a long one. I apologize, but we had a busy week. We look forward to a very slow week next week with very little news, but also to look forward to catching up with you again. See you soon.